Carol Malone is a TV presenter who sometimes appears on The Jeremy Vine Show. And that's where she completely lost it over ambulance workers' strikes.
These strikers and union bosses are weaponising frailty and sickness to get more money in their pay packet. Withdrawal of labour in the health service is an archaic bludgeoning tool to get more money. And you cannot do that in vital services like healthcare. You know, these journalists and strikers, they're engaging, it's emotional blackmail. That's what it's emotional black, and they're exploiting their monopoly that they have and the sentimentality around the NHS. It's, you know, we've got to stop pretending that the ambulance workers are badly paid. They are not badly paid. The NHS says the average pay is 34,300 with their social hours allowance, with their overtime supplements, all the rest of it. They can go to 47,000 in a heartbeat. That is not a bad pay packet.
They are not holding patients. They are not blackmailing patients.
Yes,
they are using their legitimate right to strike that is enshrined in the law.
Everything you mentioned.
Hang on a minute, Carol. Let me just finish this sentence. We have already had reform of strike laws. They are in the right place, in my opinion. You need to have a minimum number of union members voting, taking part in the ballot. Then they have to reach a minimum level in order to take union action. Withdrawing your labour is an extreme...
It's an archaic bludgeoning tool in the health service.
The idea that we're being held hostage by health workers, like thank God they trained to be health workers so they can support us. You know, it's not like they're not stopping other people become health workers. Everyone who trains to become a health worker, almost everyone who trains to become a health worker, now wants to go on strike because they're being treated so poorly. The only emotional blackmail being done there is from Carol Malone, who's saying, because your job is valuable, more valuable than her job or my job, you should feel so guilty about asserting your rights that you work without complaint. That's the moral blackmail there. And it's also weird to think of strikes as archaic. So you think workers' rights should belong to history. Oh, it's so archaic, this idea that you might strike to improve your own conditions. Not sure about that. On pay, this is a bit more complex. Malone is right about paramedic pay on one sense. According to the Nuffield Trust, if fully qualified, the average wage of paramedics is about £47,000 per year, but that's when including overtime. So actually, their salaries haven't been damaged as much as other people in the NHS because their working patterns are so reliant on overtime. Their salaries, though, are still expected to drop by 4% over the next year. And the ambulance service also involves 25,000 support staff, as well as ambulance workers who aren't paramedics. Across all ambulance workers, real terms annual salaries had only risen by £91 between 2010 and spring last year. And that's, of course, now been completely wiped out by inflation. Crucially, also, and this is really important, broader dissatisfaction among ambulance staff has long threatened a crisis in the service. So the Nuffield Trust have reported this. 1 in 10 paramedics, that's 1,760 people, left active service in the year to June 2022, exceeding the number of joiners in the same period. Over 1 in 4 paramedics reported that they would leave their role as soon as they could find another job. This compares to less than 1 in 5 nurses signalling the same intention. The working experiences of paramedics have been a long-standing concern. Compared to other staff groups, they have consistently lower levels of satisfaction, which have deteriorated further in the last year. Staff are increasingly frustrated at being unable to provide an adequate service for patients with Category 1 life-threatening calls waiting 9 minutes 56 seconds on average compared to the target of 7 minutes. For Category 2 calls, such as for heart attack or stroke, the average waiting time now exceeds 1 hour against a target of 18 minutes. Now, that report on the state of the workforce in the ambulance service is very interesting from the Nuffield Trust. Basically, the picture they're painting is that on pay, paramedics have not had a good time. You know, your wage is rising by 91 quid over 13 years. That's historically terrible, appalling. But when it comes to pay, they haven't been dealt such as bad a blow as nurses and doctors, etc., etc. But they are still even more dissatisfied. So that shows you something is going really wrong in the service. Now, presumably, that's because of the amount of overtime they're being asked to do, that they're being understaffed, that they're having to wait for hours to unload patients. So whereas before they would answer sort of 5 to 6 calls a day, now it's only 2. They see that they're not doing their job badly, they're not doing their job well because they're not able to do their job well. That's very demoralizing, of course it is. And so lots of people want to leave the service.
basically what you have here is Carol Malone, who's never worked, a shift in her life as an ambulance worker, given this national platform to talk about what it's like to be an ambulance worker and what ambulance workers do and don't deserve. And she very cynically is deliberately illiterate with her statistics. Like, she takes this one figure, which is the salary number for a specific group of people who work in the ambulance workforce, rips it from its context and uses it to undermine what an entire industry is saying. And it would be one thing if she was saying this on her dining table or in the comfort of her own home or yelling it at the TV. But she's not. She's being given this elevated national platform where it's being broadcast to thousands of people. And it's incredibly frustrating, because when a workforce goes on strike, they are communicating to us that something is not okay. Like, the workforce is not okay. And do you know how they know that? Like, where they get that information from? It's not from decontextualized statistics. It's not from, whatever agenda they might have, and Carol Malone was very clear there. She talked about the sentimentality around the NHS, the monopoly of the NHS. She's kind of hinting there what she really feels, which is that the NHS as a public service, as a nationalized service, shouldn't exist. But that's, a whole other conversation. But the people who are actually going on strike and organizing in this way, they know that these conditions are a problem because they're there. They're in the field. Unlike Carol Malone, they actually live those conditions every day. And, MPs, rent-a-gobs, management consultants, they aren't in a position to undermine what this industry, what this workforce as a collective is saying. Because let's not forget, this isn't about one or two paramedics. This isn't about, just like individuals talking. This is a collective action. This is, about what a collective industry has voted democratically to do. And I personally, I don't know a single healthcare worker that doesn't think that our system is not fit for purpose. And so I would say that this is, we know that this is the representative position of people working in this field. So, it's not emotional blackmail. It's not bludgeoning. It's not archaic. It's living in the real world and seeing what needs to happen in the real world. And, it's very clear that the real world is not a place that Carol Malone lives in.